Good morning,
Morning.
Mr. Chairman and members. Glad to be here on a Monday morning at 8 o'clock in the morning for a wonderful Public Health Committee. So
Great to have you.
Glad to be here. So Chairman Van Dever, to members, thanks for the opportunity to lay out House Bill 932. And Chairman Frank, thanks for parking the right way this morning, too. Can't say that for the guy in front of us. HB 932 would create an interstate compact for occupational therapists, or OTs, and occupational therapy assistants, also known as OTAs, to practice in participating compact states outside of their own. So in Texas, OTs play a critical role in helping injured, ill, and patients with disabilities recover and improve skills necessary for everyday life and working. The OT Compact would allow licensed OTs and OTAs to practice in any state that joins the compact, including services via telehealth. This will remove the need for practitioners to get an individual license in each state where they want to practice, reducing the administrative burden for both OTs and the state's licensing board. A few key points: 31 states across the country have already passed the OT licensure compact, and 9 other states have pending legislation. The OT compact will have no fiscal implications to the state. The goal of this bill is to help reduce barriers for OTs and help patients receive the appropriate care they deserve regardless of their location. Once the compact is in place, Texas OTs and OTAs could choose to have compact privileges by paying an add-on to their required licensing fee. There are a number of benefits of adopting the Interstate Compact, including 1, increasing market opportunities for OT and OTAs, creating administrative efficiencies and licensing boards for licensing boards and reducing duplication. 3rd, improving continuity of care when clients travel or relocate, which increases clients' ability to obtain necessary and therapeutic treatments. These benefits will help military families who are often subject to transfers between states. Texas is not new to interstate compacts, as the state is already part of other major occupational licensure compacts, including the Nurse Licensure Compact and the Physical Therapy Compact. As with other existing licensure compacts, the OT Compact has no impact on the state's scope of practice or licensure requirements. I know that's always, you're going to hear tons of bills about scope of practice. This doesn't do that. Yes. HB 932 will enhance public health across the state by strengthening service delivery and the state licensure system for OT practitioners. Finally, according to a 2018 U.S. Department of Defense report, there were roughly 117 active duty service members and 142,000 active duty family members or dependents, for a total of 260,000, roughly a little over 260,000 active duty serving in Texas. This bill aims to take a step forward in supporting military families as they make difficult transitions across the state, or across the country, sorry. Passing this bill will boost efforts for increased healthcare access, especially as we combat workforce shortages across Texas. This bill, members, is a refile from the last session. Most of you guys, voted for it unanimously out of public health, and it was voted off the House floor 141-0. We just got to do a little better job on our friends at the other chamber to get it over the line. But we're working with them. I know they're seriously considering this bill again, and so I appreciate the opportunity to be here and answer any questions that the committee might have. Chairman Van Dever, and would love to have an opportunity to close if public testimony or questions.
Okay.
Committee.
Thank you, Representative Walle.
Yes.
Members, any questions? Representative Schofield.